In recent years, neurologists have increasingly investigated the theory that viral infections, specifically herpes, might be an underlying cause of Alzheimer's disease. Within this area of study, researchers are looking closely at individuals diagnosed with symptomatic human herpes virus, or SHHV. The clinical data reveals a paradox. Symptomatic herpes drives long-term structural changes and cognitive loss, but it appears to do so without activating the typical biological pathways of Alzheimer's disease. To accurately treat the cognitive decline induced by this virus, we must first separate the mechanics of the infection from our established assumptions about Alzheimer's pathology. Tracking the precise neurological impact of a lifelong virus requires a dataset of massive scope, which is where the Baltimore longitudinal study of aging comes in. This graphic outlines the study's design, showing a surveillance period for symptomatic herpes beginning in 1960, paired with neuroimaging through 2020. To isolate variables, researchers applied rigid exclusion criteria, filtering the primary MRI analysis down to exactly 1,009 participants. 98% of the patients in this MRI cohort were cognitively normal at the time of their baseline scans. This provided a clean slate to observe disease progression. By tracking these healthy brains over multiple decades, researchers can pinpoint the exact moment and the specific anatomical location where viral degradation begins. The primary anatomical investigation relies on comparing the longitudinal MRI results of SHHV-positive patients against a control group of SHHV-negative patients. This chart plots predicted regional volume changes. Panel B tracks regions vulnerable to Alzheimer's over 10 years. Trajectories for both cohorts remain completely parallel. Divergence occurs elsewhere. In panels C and D, tracking white matter, infected patients follow a steeper downward trajectory than the control group. This table quantifies that loss. The linear mixed effects models show the infected group experienced an annual additional reduction of 0.336 cubic centimeters of total white matter, and a 0.079 reduction in the temporal region specifically. The data confirms that this degradation is highly localized to the temporal cortex. Symptomatic herpes accelerates aging by systematically degrading the brain's temporal white matter, the internal wiring, while memory-forming structures remain on a normal aging path. We can trace this physical white matter loss to its clinical outcome by looking at the patient's performance across 5 standardized cognitive domains. At their baseline visits, the statistical data showed a slight anomaly. The SHHV-positive group actually recorded marginally higher scores in certain cognitive areas. This chart tracks cognitive scores longitudinally. In Panel A, measuring attention, the baseline advantage disappears, replaced by accelerated cognitive decline. Isolating the data by age in Panel D, this steepening drop-off in the infected cohort becomes highly visible past 70 years old. The models assign a specific penalty to this decline: an annual additional drop of 0.01 z-score in the infected group's attention span. A symptomatic herpes infection manifests as an accelerating inability to sustain focus over a lifespan. This deficit correlates with temporal white matter damage rather than the memory failure associated with Alzheimer's. To identify the mechanism driving this white matter loss, researchers examined cross-sectional blood plasma data from 775 of the participants. These box plots display plasma biomarkers. In Panel A, the amyloid beta ratio, Alzheimer's primary signature, shows a statistically insignificant p-value. Additionally, neurofilament light in Panel C shows no significant elevation. However, Panel B shows a distinct statistically significant increase in GAFP. GAFP is the primary chemical signal for astrogliosis, a condition characterized by chronic astrocyte activation and neuroinflammation. Symptomatic herpes triggers a state of smoldering neuroinflammation that acts as the chemical catalyst for white matter atrophy. The longitudinal data maps a complete, independent pathological axis. A symptomatic infection triggers an elevation in GAFP, which leads to temporal white matter loss and a resulting decline in attentional performance. Symptomatic herpes is a potent neurodegenerative force, but it operates on a pathological axis distinct from Alzheimer's disease. Recognizing this decoupled pathway suggests that medical interventions for viral-induced cognitive decline must target different mechanisms than those used for amyloid-based diseases. Within the cohort of 119 infected patients, researchers tracked a critical clinical variable, the application of standard antiviral treatments. Patients exposed to these antiviral therapies experienced a measurable attenuation in white matter decline, specifically in the occipital region, saving 0.10 cubic centimeters of brain volume annually. Early and aggressive pharmacological management of the herpes infection offers a potential preventative protocol against longitudinal white matter atrophy. By untangling the virus from the pathology of Alzheimer's, clinicians now have a clear target for protecting the structural integrity of the aging brain.